suppose, how do you see crime reduction rather than crime reduction as a priority of the Baillieu government, and the related services around housing and homelessness and alcohol and drug treatment and other services?
Well, it's definitely a two-pronged attack. So, and there's been a lot of coverage in relation to the law and order side of the agenda, which in many ways is dealing with people who have been unable to get access to the care and support they need to address the issues that they have that are sitting behind the violence that we are seeing. But there's a definitely, clearly much longer term agenda about how do we stop the violence going forward. And there's a lot of statistics there, but the trouble is the abuse figures have gone up, the violent crime figures have gone up significantly. And the other thing is people don't feel as safe either. I mean, even looking at the Community Indicators report from a couple of years ago, people don't feel safer in their communities, in their homes, in their streets, on public transport or in the city compared to how they felt 10 years ago. So, we can throw around all the statistics, but there's this sense of safety as well that I think is very important, and people want to have confidence that they can go on the train, they can go into the city, that their kids are going to be safe when they go out at night, because there's a concern that they can't. But sitting alongside the law and order agenda is very clearly all the things that we've talked about today. When you have a look at who's in youth justice, 85% of people are there as a result of their drug and alcohol issues. As we talked about earlier, suspended and expelled from school, nearly half. Nearly a third have been in the child protection system. A quarter have mental illness or an intellectual disability or impairment. So these are all the issues we've been talking about early. We've got, I think, a great mental health policy which intervenes early, supports young people and tries to do community-based care to stop people getting into acute hospital situations and acute episodes. We're going to have some very proactive drug and alcohol policies with more treatment, focusing on some of those growth areas where they can't access services. We've got welfare officers in schools and positive initiatives about how we keep young people connected into schools, and if the school system doesn't work, then the alternative system can potentially work for them in a different way. So I think across a whole range of areas, we've got a very strong preventative agenda. But the reality is that's going to take some years to work through the system. So that's why we've got this dual approach. We have to address the law and order issues that we have now. We have to make sure that there's very clear messages that violence is not acceptable, and we have to address them, and we have to support the community to feel safer in their homes, in their streets and in the city. But in the longer term, we'll be investing immediately for longer term outcomes so the next generation, and even the generation now, can access the treatment support they need. And when they're thinking about crime situations in the future, they're making positive decisions rather than those decisions which will ultimately end up in youth justice. And I think, just get on child protection, a lot of the policies, commitments that we've made, particularly about the transition, supporting people in out-of-home care and the transition to independent living, will once again have a huge impact on people entering youth justice. And we know that once they're in youth justice, the recidivism rates are very high. If we can support that transition to effective and independent living with employability skills and jobs ultimately in the future, that will have a huge inroad as well.
Thank you. Next big topic, cost of living and utilities, and I guess the broader issues around climate change and the social equity issues around climate change and the pressures on individuals, families and communities around that. The most immediate issue, I suppose, that's been getting coverage has been the fast rising price of utilities and the impact that has, particularly on low-income households. So our first question, I suppose, is whether a Baillieu government would match the current Labor government's commitment to a new summer electricity concession and commit to completing the concessions review that's just begun, which will recommend changes to electricity concessions to mediate the impact of new tariffs made possible by smart meters, the time of use and other variations.
Well, we've been very concerned about smart meters. I'll start with that end first in relation to overall what's happened, because a huge blowout in cost and all the functionality has been removed. So the benefits of them being implemented are actually not there, and what every household has been left with is a massive cost of their implementation. So we've been very frustrated about that rollout, and actually believe that that shouldn't have been done, that the functionality should have been aligned with the rollout, and believe that should be stopped until the rest of the issues can be sorted out without the massive cost. And I'm sure we've each had hundreds of constituents who have come in really feeling the cost of that without any benefit whatsoever. The concessions is absolutely important, and we're going to make a number of commitments in relation to making sure that low-income households can continue to access support to reduce their electricity costs. We will continue the rollout of the renovations of public housing to be more energy efficient. We will also, though, be making sure that people in low-income households know where they can go to actually access what is a plethora of supports and grants and programs to actually be able to make those changes. What we've seen is there's lots of different things out there, but people don't know where to start, don't know how to access, don't know how to go about it. And we are committing to aggregate that information and work along low-income households so that they can know how they can make the shifts they need to make, and then access the different programs and grants and funding to be able to then change their dual flush toilets or put in insulation. No one talks about insulation anymore, but the fact is it can make a huge difference. What other things can they do? What sort of audits can you do to your household to actually work out how you can reduce your energy costs? So we believe an aggregator or someone dedicated to work alongside low-income households will make a huge difference to them being able to access to know what to do and then know what to access. In terms of the energy concessions, we're still having a look in terms of the review, and we'll want to see the broader outcomes and support that continuing so that we can actually know the lay of the land and where we can most effectively continue to invest so that people can continue to afford to live in their homes and do so in a way that enables them to be cool, as well as make decisions about what they're eating and paying their rent in situations as the case may be.
Okay, thank you. So I suppose the broader approach, we've got through a lot of our specific questions. It's really an opportunity, if there are things that we haven't talked about yet that you feel VCOS members would be really interested in hearing about, now's the opportunity to speak to those commitments or to those things.
Yeah. I just think, looking at education, I think I have 15 years experience as a school principal, and I think I know the sector pretty well, and I just very, very keen for communities to be really involved in their schools, because I think no matter what the needs of the community are, I think the constant there is the local school and the relationships they have, and I think that's a strong basis on which we can build. So the broader community using the school community, reaching out and using the community, and a lot of the social services that we've talked about today. The school's a wonderful place to deliver those, because there's a high degree of trust there, and I just think we really need to truly open our schools to the community, and that doesn't mean having the gym used on an extra night a week or something like that. As good as that is, it's the people and all the resources of the school being open to the community, but also allowing the community to come in. So that's sort of my vision that I see for schools. I see them as community schools. Is the it sounds very nice, but I think there is a real sense. I think our schools should be communities, centres for the community. And when we see the large growth in non-government schools, I think what people see in those is a sense of community, whether it's a sense of values or whatever it might be. People are attracted to a sense of community, and there's no way, and government schools are able to have that sense of community, I think, too. And we've got to allow that to build up, and they'll become very, very attractive places, I think.
Thank you, Martin.
Well, in terms of the early childhood agenda, I guess that the the Liberal Party are very aware of the importance of the early years of a child's life and in investing in those years. And we want to start from really before a child is born, and Mary has a plan to start with working with families who are at risk through to 4 years of age. We also want to work with local government to strengthen their early years plans and to ensure that not only are they providing the services that need to be provided in their area, but also that they have policies that are child-friendly within their city. And we have in our early years policy an investment in breastfeeding to ensure that mothers are supported to breastfeed, and we know that breastfeeding does give children the best start in life. We also have a commitment to train more maternal and child health nurses. The maternal and child health system is vital to supporting young families, and particularly families that are at risk, and our maternal and child health nurses are an aging workforce, and local governments are telling me they have great trouble in recruiting triple certificate nurses, so we have a plan for some additional scholarships to train maternal and child health nurses, as well as investing in early childhood education and care services, as we outlined earlier in the interview. And on housing, we want to see better management of public housing and community housing in Victoria, and we certainly will be placing a great emphasis on the importance of economic participation by public housing tenants to ensure that they can break out of those cycles of disadvantage. And we see on some of our public housing estates huge numbers of unemployed people, and we want to see that and children on those estates often have no role models that participate in the workforce. So we want to see those schools that service those estates resourced to ensure that those children have opportunities in education and to break out of those cycles of disadvantage as well. And I guess it's about a more responsive sort of type of management too, more responsive to the tenants' needs, and also more responsive to changes that are happening in the housing sector. And we've seen this government very slow to act on the changes that have happened in the rooming houses. We've known since 2002 that there's been enormous problems in the rooming house sector in this state, and yet it wasn't until 2009 when the coroner was about to hand down his results of the investigation into the Brunswick rooming house fire that the government then appointed their task force, and it took them an additional 12 months to bring legislation into Parliament to say that we can now make regulations. The regulations haven't been made. We can now make regulations to improve standards in rooming houses. So we would act sooner to ensure that those changes are addressed.
I think we've only got a minute or so left, Barry.
Well, the one group I don't feel we've touched on very much is carers, and I know you have a lot of members who are organisational members, but you have a lot of individual members as well. And we haven't touched on respite, absolutely desperate issue to continue to support carers doing the role that they do, which is absolutely valued and incredible. So we will be investing in some more flexible respite as well to make sure that carers can access it, because they find it very complex and hard to access. Also, after school or school holiday respite for children, which often parents are crying out for as well. So we also believe that we should have carer recognition legislation in Victoria. The feds have just done it. Every state Victoria does it. Every state except Victoria does it, and we'll be bringing forward, I think, a much stronger agenda in relation to carers, the role they play, the importance they have in terms of the treatment, the care and the recovery of the person that they care for, and making sure they're celebrated and supported in the roles that they have. Broadly though, I think wrapped up a bit in terms of we have a very strong, I think, social agenda in relation to people accessing services when they need it, getting in early, getting the support, and making sure people, particularly young people but families, can achieve their full potential and are supported to do so, accessing the services they need when they need them.
Thank you, Mary. I think we'll wrap it up now. So thank you very much indeed, Martin, Wendy and Mary.
Thank you.
And we look forward to continuing to work with you.
Thank you.
Thanks, Kate.
Thanks, Kate.